Today we'll start the inferior extremity, the venous and the lymphatic drainage of the inferior extremity. You know the inferior extremity, it is the thigh, it is the leg, it is the foot. And just at the junction of the abdomen and the inferior extremity, here, if we cut the skin and the superficial fossa, you will find a ligament, very strong ligament. We call it inguinal ligament. We call it inguinal ligament. We call it inguinal ligament, one on either side. And the venous drainage of the inferior extremity, the veins of the inferior extremity are arranged in, mainly you can classify, not arrange, better to say you can classify into three groups. What are they? Number one, superficial veins. Superficial veins of the inferior extremity. Number two, deep veins of the inferior extremity. Number three, communicating veins or perforators. Communicating veins or perforators. Perforating veins. Clinically, this classification is very important. Superficial veins, deep veins, and perforating veins. What are they? If we cut the skin and reflect the skin one on either side, you will find the superficial fossa. In the superficial fossa, you will find veins. And these veins, there are small veins are there, unnamed veins, that is not important, but some long veins are present. They are named. Tader naam ache. They are called superficial veins. Actually, any veins present in the superficial fossa are superficial veins, of which few are very important and we name them. For example, great saphenous vein, short saphenous vein, and their branches, tributaries, and their tributaries. We call it superficial veins. Now we reflect the superficial fossa, you will find the deep fossa of the inferior extremity. If we cut the deep fossa, you will find the muscles and deeper to the muscle bones. And you will also find very important veins there. Few veins are accompanying the arteries. They go side by side with the arteries. And few veins are present within the muscles itself, of which the most important muscle is the calf muscles. Soleus. There are three calf muscles in the back of the leg. They are called triceps suri. Tri means three, triceps suri. Two gastrocnemiae, medial and lateral, and soleus. Within the soleus, very important, strong and back muscles, there are within the muscle bulk present veins, but here the veins are arranged as a sinusoids. I will tell the difference between veins and sinusoids. Now for the time being, the larger veins we truly without any valve we call sinusoids, right? And also other muscles also contain the veins within the muscles, of which the most important is the veins present within the soleus as a sinusoids. These are called the deep veins. So, if it is the inferior, we are viewing from the lateral side. This is the skin. Deep to the skin, the superficial fossa. Here is the backside skin and the superficial fascia, and deep to the superficial fascia, it is the deep fascia. It is the deep fascia. Within the deep fascia, inside the deep fascia, this is, and central part, there is the bone. And this is the muscles. It's a schematic diagram. These are the muscles. And also, there is the arteries. These are the muscles. You will find some veins, few veins, or the venous veins accompanying the arteries. Accompanying the arteries. Some veins present within the muscle bulk itself. These muscle bulk also connected with the deep veins. Now, in the superficial fascia, there are superficial veins. So, this is the superficial vein, this is the deep veins. This is the superficial vein, superficial to the deep fascia. This is the deep veins, deep to the deep fascia. And some veins connecting the superficial and the deep veins. These are called the communicating veins or perforating veins or perforators. So, there are three types of veins: superficial vein, deep vein, and perforators. What is the importance of this? All the veins of the inferior extremity are valve. There is a valves are present. This is the veins. Within the course of the vein, like the tricuspid, there are valves are present, like the heart, tricuspid and bicuspid valve. There are valves, flaps of tissue. When blood flows from distal to the proximal towards the heart, from the foot to the heart, these valves, when the blood flows, these valves gets opened so that blood can flows from distal to the proximally towards the heart, centrifugal to the centripede, goes to the centripetally. But when the blood is going in the opposite direction, valve is closed. So no blood can go down. So this is the importance of the blood. That is the function of the blood is, valve is what? Unidirectional flow. Unidirectional flow. So that the venous blood can go from the periphery to the centrally. That's the most important part of the valves. All the veins of the superior extremity valve. Of which the most important is the valves present in the perforators veins, communicating veins. What is that? The perforating veins are such. This is the perforating veins. The valves are such so that blood can only go from the superficial to the deep veins, not in the opposite direction. blood can go from the superficial veins to the deep veins, not in the opposite direction. When there is opposite direction, valve gets closed. So, what is the importance that? So, if it is the superficial vein, it is the deep vein, blood can flow in this way. When the blood tries to go, these valves are closed. So, what happens? And you know, the deep veins are of high pressure veins. The pressure in the deep veins is very high comparing to the pressure of the blood present in the superficial veins. So, if there is a defect in the valve, if the valves are defective, so what's happened? It cannot close properly. It cannot close or shut off properly, so that from the high pressure deep veins, blood flows to the superficial veins. It is not desirable. So, if the bloods are defective, we call medically defective blood incompetency of the valves. Defective we should not use, it is the layman's term. We call incompetent valve. Incompetent valve. So, if the valves are incompetent, so blood goes from the deep vein to the superficial vein, and superficial veins then become dilated, elongated, lamba hoye jay, and become tortuous. So, the superficial veins then become dilated, elongated, and tortuous. Eram hoye jay. And we name them when the veins are dilated, elongated, লম্বা হয়ে যায়, কারণ অনেক ব্লাড যাচ্ছে, স্ট্রেচ হয়ে যায়, it gets stretched. So, when the veins are dilated, elongated, and tortuous, we call it varicose vein. That is the clinical term. We call it varicose vein. And the or varicosity of the veins. And this varicosity of the veins mainly occurs in superficial veins. Not only the incompetence of the valve, if there is a thrombosis, I have already described, there is a blockage of the veins during its course of the deep veins. So, the blood cannot go up, so it tries to go to the perforating veins, making the valves incompetent, and again there is maybe development of the varicosities. Same thing, when there is high rise of intra-abdominal pressure, so veins cannot go up, so the deep veins become, pressure builds up. When there excessive pressure builds up in the deep veins, they push, they try to flow the blood through the perforating veins to the superficial veins. Or better to say, when the pressure is too high, pressure is too high in the deep veins, then superficial, this too high pressure makes this valve incompetent, and again the varicosity develops. So, incompetency of the valve, venous thrombosis, high rise of intra-abdominal pressure may give rise to varicosity of the superficial veins of the inferior extremity. Next thing is that, another thing, you look here, I draw here in the thigh, already I have told in class, in one batch. For example, femoral vein or এখানে axillary vein. It is accompanied by a single vein, axillary artery, femoral artery is accompanied by corresponding artery. Artery is one, vein is also one. One axillary artery, one axillary vein. One femoral artery, one femoral vein. But this is not the true below the knee or below the elbow, distal to the elbow or distal to the knee joint. Here, for example, below the knee, the artery is anterior tibial and posterior tibial artery. Below the knee, there is an anterior tibial and posterior tibial artery. This is the anterior tibial artery. If we dissect, you will find there are two veins, one on either side. And pair of veins, and centrally the artery is present. We call the veins the Venae Comitantes. Venae Comitantes paired. So anterior tibial artery, the better term is not the anterior tibial vein, it will be Venae Comitantes of the anterior tibial artery. Posterior tibial artery and accompanying vein, all right, veins, লিখতে হবে accompanying veins, কারণ singular নয়, কিন্তু femoral artery with its accompanying vein, singular number. Why it happens? There are so many theories. Obviously, the most important theory is that in the distal, the veins going against the gravity. The venous blood is going against the gravity. Artery has got its power. Heart is pumping, very high pressure. Not only that, arterial wall is very thick. It has got muscles, thick muscles, elasticity. So artery also squeeze the blood and flow towards the, from central to the peripheral region. But the veins in the opposite direction, against gravity, wall is very thin. So how the blood will go from distal to the centrally? So there must be some mechanism. The most mechanism, the here in the Venae Comitantes, already I have given an example. If you carry 20 kgs in one hand, it is very difficult to carry 20 kg by one hand. But if you distribute the 20 kg into 10, 10, you can easily carry. So, the venous pressure is very high here against the gravity. So, the weight of the column of the blood is distributed on two sides, so that it is very easy to carry the blood. Number one. Number two, artery has got pulsation, so it develops some kinetic energy. Artery has got some energy in its wall, some kinetic energy, force. These arterial pulsation, this energy is transmitted to the side by side veins. The veins present one on either side. And veins utilize this energy so that the blood can go. But the middle, she is artery, she has got energy moving. So we push the two ladies present one on either side of her. So the girls also move. It transfers this energy from central to the peripheral region. So transfer of energy. So veins also got some energy from the arterial pulsation, and this energy is utilized by the veins to proceed against the gravity. Third and the most important is that Vis-a-Tergo. Vis-a-Tergo. খুব সহজ জিনিস, নামটা এরকম হলো, very easy. When you take respiration, especially inspiration, the diaphragm descends. When take inspiration, the diaphragm descends so that intrathoracic pressure becomes negative. Plus contraction of the heart sucks, টেনে নেয়, negative pressure এখানে একটু positive. So it sucks the blood from the periphery to the central. And this sucking of the blood is known as the Vis-a-Tergo. এটাও help. আর যেটা পরীক্ষায় দেবে, যেটা ইচ্ছে করে লাস্টে বললাম, লাস্ট হচ্ছে হেল্পিং হাউ দ্য ভেনাস inferior extremity venous blood, এবারেও কোশ্চেন এসেছিল, if the question come goes to the helps in the venous return in the inferior extremity. Last question is last factor is very important. That is known as the soleal pump. Soleal pump. Soleal pump. ব্যাপারটা কি? Soleus is a muscle, I have already told you. Soleus is a muscle. Suppose this is the muscle. This is the deep veins. Within the muscle, the veins, artery and veins are present. Within the muscle, every muscle, there are arteries, small arterioles and veins are present. আমি artery আঁকছি না. So, veins are present. These veins, but these veins are not present like this. It is present as a communicating sinusoids. Sinusoids, simply speaking, it is a veins where the diameter is slightly larger than the veins, and there in the veins there are some pores through which the blood can enter or go plasma. The pores are slightly larger. This is the basic difference between the veins and sinusoids. And most important is that these are also vein, but they are slightly dilated, ekটু বড়, and communicating. One vein is, suppose this vein is communicating with this vein is communicating with this vein, so communicating sinusoids. And there are no valves. Here there is a no valves. Valve nahi. There is a no valves in the sinusoids. So, what is the function of the heart? Contraction. When the ventricles contract or atria contract, whatever it may be, when atria contracts, energy is developed, blood is pushed from the atria to the ventricle. From the ventricle is contracting, blood is pushed to either to the pulmonary artery or to the aorta. Similarly, when we walk, when we stroll, soleus is contracting. The muscle is contracting. Every muscle, when there is an activity, it contracts. Whether it is a deltoid, whether it is a biceps, whatever it may be. So, when we walk, so soleus muscle contracts. And soleus muscle contracts. And it gives, like a heart, it gives pressure to the sinusoids. It creates a pressure. So these sinusoids are also squeezed like the ventricle, like the atrium of the blood, heart. So blood is pushed from the soleus sinusoids to the veins and go up. And it also creates a pressure so that it goes up. High pressure. This blood is pushed from the venous sinusoids to the veins, and this pressure pushes the blood up. Clear hoyeche? So it is like a heart. So soleus muscle is called peripheral heart. Soleus is called peripheral heart. সোলিয়াস মাসলটাকে আমরা বলি পেরিফেরাল হার্ট। এক্সপ্লেইন সোলিয়াস ইজ এ পেরিফেরাল হার্ট। অনেকবার কোশ্চেন এসেছে, তখন লিখতে হবে সোলিয়াস কন্টেন্স the veins has a sinusoids, communicating sinusoids. When the soleus contracts, it likes a heart, pushes the blood. আর এইখানে সোলিয়াস মাসেলে কিন্তু প্রচুর ব্লাড থাকে। এই যে সোলিয়াস সাইনোসয়েডসে হিউজ কোয়ান্টিটি অফ ব্লাড ক্যান accumulates present because soleus is a very big muscle. So when soleus contracts, like a ventricle, like a heart, it pushes this blood and this energy also transmitted to the deep veins and goes up. So soleus is called a peripheral heart. So what is called peripheral heart? Sir, soleus muscle. Like a heart, when soleus contracts or pump, it pumps the blood from its sinus, push the blood or pumps the blood from the soleus sinusoids to the veins, and this blood also pushed up towards the heart. Very, very important. So, especially the patient lying in a bed for a prolonged period, or we can not like when we sleep, it only few hours. It doesn't mean anything. But when days after days, the patient is lying in a bed without any movement of the soleus, the blood circulation of the soleus, the blood is very sluggish, very slow. And whenever there is a sluggish, especially in the veins, there occur formation of a thrombosis. Slow circulation, coagulation system activate kore, and there is a presence of thrombosis. These thrombosis sometimes dislodged and go to the veins, through the veins and go to the heart and can distribute anywhere from the heart, even go to the pulmonary artery to the lungs, blocking the pulmonary artery, causing pulmonary embolism, or especially common, and patient may die. সুতরাং পেশেন্টের কিছু মুভমেন্ট শুয়ে থাকলেও করা উচিত। Physiotherapy should be done. So these are the initial introduction of the supix and venous drainage of the superior. The classification of the veins are the superficial veins, deep veins, perforating veins. The first vein, the superficial veins, is the great saphenous vein. What are the example of the superficial veins of the inferior extremity? Mainly two, and they are tributaries. Some few tributaries has got also name also. What are the important veins clinically and also for examination? Great saphenous vein, the longest vein in our body. Like this here, and great saphenous vein is known as the preaxial vein. Actually, during development, even in the superior and the inferior extremity, this radius, in case of the superior extremity, radius, this is the thumb, radius, this is called the preaxial border. This lateral side, lateral border, it is called the preaxial border, and this little finger and the ulnar side is called the postaxial border. Similarly, in the leg, the great toe and the medial side is called the preaxial border, and little finger and the lateral side of the leg we call and the lateral side of the thigh we call the postaxial border. So it is present in, it is called the preaxial vein of the lower limb. Similarly, cephalic vein is the preaxial vein of the upper limb. Right? So যদি শর্ট কিছু দেয় introduction, it is the longest vein in our body and it is the preaxial vein of the inferior extremity. Next is the formation. Formation is at the level of the, in the dorsum of the foot. You know, it is known as the digits, little toe and 5 digits are present. And from the digit, both from the lateral and medial side, the digital veins are formed. From the digital veins are formed. Digital veins are these are the digital veins. One on either side of the finger. Toes, sorry, finger ki bolchi. And ultimately these digital veins join with one another to form a venous arch. একটার সাথে একটা জয়েন করলো, এই একটা ডিজিটাল ভেইন, এই ডিজিটাল ভেইন, এই ডিজিটাল ভেইন, এই ডিজিটাল ভেইন, এই one join with one another to form a network and we call the dorsal venous arch. Dorsal venous arch. A dorsal venous arch are contributed by all the digital veins except two. কি two? একটা হচ্ছে medial side of the great toe. এইটা medial side of the great toe. এটাকে নাম দিয়েছি আমরা medial marginal vein. Similarly, lateral side of the little toe, আমরা এটার নাম দিয়েছি lateral marginal vein. এখন লাগবে না ওটা, কিন্তু এইটা লাগবে. So this is the dorsal venous arch and the great saphenous vein is formed the dorsum of the foot close to the medial malleolus by joining the medial end of the dorsal venous arch and the medial marginal vein. 1, 2. এই যে dorsal venous arch এর একটা medial side আছে, একটা lateral side আছে. এই medial end of the dorsal venous arch আর medial marginal vein দুটো জয়েন করে great saphenous vein হয়. Just in front of the medial malleolus, this is the medial malleolus, this is the lateral malleolus of the fibula. It is the medial malleolus of the tibia. তাহলে formation on the dorsum of the foot, just close to the medial malleolus, by joining with the medial marginal vein and medial end of the dorsal venous arch. Dorsal venous arch describe করতে হবে না তোমাকে পরীক্ষায়, শুধু বলবে joining with the medial end of the dorsal venous arch with the medial marginal vein. Formation শেষ. তাহলে formation কোথায় হচ্ছে? এইখানে, not here, আপে কিন্তু ভেনের ফর্মেশন হয় না, distally here. তাহলে 1 introduction, 2 formation, 3 course. কিভাবে যাচ্ছে? Then it ascends, ওপরে উঠছে, and passing 2.5 centimeter in front of the medial malleolus. Then it ascends এইটা medial malleolus. Then it ascends and passing 2.5, এইটা হচ্ছে 2.5 in front, এটা হচ্ছে medial malleolus. Passing in front of the medial malleolus, then it ascends up, then crossing the medial third of the tibia, medial third of the leg, and ascends 1 finger breadth behind the anterior border of the tibia, shin. This is the patella. Then it passing one hand breadth posterior to the patella, then along the medial aspect of the thigh up to saphenous opening. Femoral triangle korecho. You know the saphenous opening? Jano to? Pubic tubercle 3 centimeter below, slightly lateral to the saphenous opening. So here there is a saphenous opening. আর এখানে একটা ফাসা আছে এরকম কি বলে এটাকে cribriform fossa. Very, very, very good. So then it wins back and এই জায়গাটায় ঘুরে গেল. We are seeing the cribriform fossa and ultimately it drains into the femoral vein. So formation is here, ascends along the tibia. আর এইখানে তুমি কোথায় খুঁজবে? এইখানে একটা হাত, পেশেন্টের হাত, যার বেন তার এইখানে ওয়ান হ্যান্ড রাখবে, এইখান দিয়ে যাবে, তারপরে মিডিয়াল অ্যাসপেক্ট অফ দ্য থাই অ্যান্ড আলটিমেটলি it winds round, piercing the cribriform fossa and enters the femoral vein. Termination. Next question কি? Termination তো বলে দিলাম. Next হচ্ছে tributaries. What are the tributaries? In the thigh, মুখস্থ করে নেবে, anterolateral vein of the thigh, anterolateral vein of the thigh, মুখস্থ করবে, because it is present in the anterolateral aspect. And this vein crossing the apex of the femoral triangle, যাকে দরকার নেই. এইটা important. Posteromedial vein of the thigh. Posteromedial vein of the thigh, they are the tributaries. They are draining into the great saphenous vein. এই posteromedial vein of the thigh, tricky যারা ভালো রেজাল্ট করবে জিজ্ঞেস করবে, another name of this vein is the accessory saphenous vein. যেমন থার্ড করোনারি আর্টারি বলেছিলাম, রাইট কোনাস আর্টারিকে থার্ড করোনারি আর্টারি বলে when it arising from the aorta. Similarly এর কয়েকটা ট্রিকি একটা খাতায় লিখে রাখবে, থার্ড করোনারি আর্টারি একটা আলাদা খাতা বানাবে, এইগুলি অনেক সময় এক্সামিনার বোঝার জন্য যে তুমি একটু আছে জিজ্ঞেস করে. So this posteromedial vein of the thigh, sometimes called accessory saphenous vein. Accessory saphenous vein. Next, এইখানে আছে anterior vein of the leg. আরেকটা ভেরি ইম্পর্টেন্ট ভেন, সেটা একটু বলবো, posterior arch vein. Posterior arch vein. আর ফর্মেটিভ ট্রিবিউটারি তো মিডিয়াল মার্জিনাল ভেন. এছাড়াও আমি এরপরে আমার আগে বলা উচিত ছিল, ভুলে গেলাম, এইখানে তিনটে ভেন জাস্ট বিফোর পিয়ার্সিং দ্য ক্রিব্রিফর্ম ফাসা, এই ক্রিব্রিফর্ম ফাসা পিয়ার্স করার আগে এখানে তিনটে ভেন আছে. Superficial circumflex iliac, superficial external pudendal and superficial epigastric. এখানে ভেরি ভেরি ইম্পর্টেন্ট, এরপরে আমি বলবো. এই যে একদম এক্সট্রিম এদিকে গেছে, এটার নাম হচ্ছে সুপারফিশিয়াল সার্কামফ্লেক্স ইলিয়াক ভেন. সুপারফিশিয়াল সার্কামফ্লেক্স ইলিয়াক ভেন্স, এই ভেনটার নাম হচ্ছে সুপারফিশিয়াল এক্সটার্নাল পুডেন্ডাল, হ্যাঁ, সুপারফিশিয়াল এপিগ্যাস্ট্রিক ভেন, সুপারফিশিয়াল এপিগ্যাস্ট্রিক ভেন. আর এই ভেনটার নাম হচ্ছে সুপারফিশিয়াল এক্সটার্নাল পুডেন্ডাল ভেন্স. ভেন্স ফ্রম দ্য স্ক্রোটাম, লেভিয়াম মেজাস, পেনান্স থেকে নেয় ভেনগুলি. And after piercing the cribriform fossa, just before it entering the femoral vein, another veins drain into the great saphenous vein, that is the deep external pudendal vein. Deep external pudendal vein. Deep external pudendal vein. এইখানে একটা ভেরি ইম্পর্টেন্ট জিনিস বলছি। There is a vein present here. একদম এখান থেকে এখানে। It is known as the thoraco-abdominal vein. ব্যাপারটা কি হলো, কেন বলছি এটা? It is known as the thoraco-abdominal vein. এইখানে আমরা একটা ভেইন আছে জানি, অ্যাক্সিলারি ভেইন, তাই তো? অ্যাক্সিলারি ভেইন আছে তো, অ্যাকম্পানিং দ্য অ্যাক্সিলারি আর্টারি। অ্যাক্সিলারি আর্টারির যেরকম ব্রাঞ্চ আছে, ঠিক সেই রকম ভেনাসেরও ট্রিবিউটারি আছে। সেই রকম অ্যাক্সিলারি ভেনের একটা ট্রিবিউটারি হচ্ছে ল্যাটারাল থোরাসিক ভেইন। ল্যাটারাল থোরাসিক ভেইন which drains into the axillary vein. So lateral thoracic vein is a tributary of the axillary vein here, superior extremity. আর এইখানে আমি কি বললাম? Great saphenous vein draining into the femoral vein. এইখানে একটা ট্রিবিউটারি রয়েছে। কি এটা ট্রিবিউটারি? সুপারফিশিয়াল এপিগ্যাস্ট্রিক ভেইন। বললাম তো, সুপারফিশিয়াল এপিগ্যাস্ট্রিক ভেইন এই একটা ট্রিবিউটারি। এই ল্যাটারাল থোরাসিক ভেইন and superficial epigastric vein is connected by a long vein, and this vein is the thoracoepigastric vein. Thoracoepigastric vein. So এইটা কোথায় ড্রেন করছে? axillary vein becomes subclavian vein. Axillary vein ultimately becomes subclavian vein. Subclavian vein joined to form joined with internal jugular vein to form the brachiocephalic vein. Brachiocephalic vein of the right and left joined together from the superior vena cava, which ultimately goes to the right atrium of the heart. তাই তো? Axillary vein becomes subclavian vein. Subclavian vein joined to the internal jugular vein. From the right brachiocephalic vein, we join with the left brachiocephalic vein to form the superior vena cava, which ultimately opens into the right atrium of the heart. Similarly, femoral vein become, when it crosses the inguinal ligament, enters the abdomen, it becomes the external iliac vein. এই ফিমোরাল ভেনটা যখন উপরে উঠছে, এখানে আসছে, নাম চেঞ্জ হয়ে যাচ্ছে। দ্য নেম ইজ বিন চেঞ্জ, উই কল্ড এক্সটার্নাল ইলিয়াক ভেন। দিস এক্সটার্নাল ইলিয়াক ভেন join with the internal iliac vein to form the common iliac vein. Common iliac vein of the two sides form the inferior vena cava, which ultimately open into the right atrium. তাহলে ultimately তোমার সমস্ত blood ultimately goes to the femoral vein, external iliac vein, common iliac vein, then the inferior vena cava, ultimately to the heart. So, if there is a tumor in the apical region of the lung, so there is an obstruction of the subclavian vein or obstruction here, any lymph node or anything obstructed here, or it may be obstruction here. If there is an obstruction here, normally blood will go these to the right atrium, right? But here there is an obstruction, blood cannot go, so blood come in this fashion and goes to the heart. So it is an important communication between the veins of the superior extremity and the inferior extremity. উল্টোটাও ঠিক, এইখানে যদি অবস্ট্রাকশন হয় ব্লাড আবার এই দিক থেকে গিয়ে এই দিকে গিয়ে ওপর দিয়ে চলে যাবে। সো thoracoepigastric vein, এই lateral কি বললাম, হ্যাঁ, thoracoabdominal vein is a very important vein communicating the superior venae branch, tributary of the superior venae cava with the inferior venae cava. ক্লিয়ার হয়েছে জিনিসটা? এইখানে যদি অবস্ট্রাকশন হলো, ব্লাড যেতে, নর্মালি ব্লাড এদিক দিয়ে যাচ্ছে, যেতে পারছে না, তখন এখান দিয়ে বাইপাস করে চলে গেল হার্টে। অ্যাট লিস্ট ফর দ্য টাইম বিং পেশেন্ট ইজ সেফ, না হলে এই জায়গাটা বিশাল ফুলে যেত। সুতরাং দিস ইজ দ্য ইম্পর্টেন্ট tributary. So all the tributaries of the great saphenous vein. Next আমি যেটা বলবো, there occur perforating veins. Which communicates with the great saphenous vein with the deep veins. Deep veins এখানে কি কি আছে? Femoral vein. Femoral vein ultimately at the populate divides into anterior tibial vein and posterior tibial vein. These are the named deep veins. Anterior tibial vein, posterior tibial vein join to form the কি vein করে? Femoral vein. Popliteal vein. Popliteal vein ultimately continued as a femoral vein, which ultimately continued as the external iliac vein, ultimately goes to the inferior vena cava. So these are the deep veins. This is the skin. This is the superficial fascia. So these are the great saphenous vein present in the superficial fascia. So there are some communicating veins or perforating veins communicates the great saphenous vein with the superficial, with the deep veins. First important communication is at the adductor canal, Hunterian canal. Adductor canal পড়েছো তো, এখানে রয়েছে এই ফিমোরাল ট্রায়াঙ্গেল, এই জায়গাটাকে বলে অ্যাডাক্টর ক্যানেল। এই অ্যাডাক্টর ক্যানেলে দেয়ার ইজ অ্যান পারফোরেটর, তার নাম হচ্ছে মিড হান্টার পারফোরেটর। মিড হান্টার, কারণ এই অ্যাডাক্টর ক্যানেলের আরেকটা নাম হচ্ছে হান্টারিয়ান ক্যানেল। দ্য ফার্স্ট ফিজিশিয়ান হু ডেসক্রাইব দিস ক্যানেল, ডক্টর হান্টার। সো দেয়ার ইজ অ্যান communicating canal passing through the deep fossa. It is known as the Hunterian perforator or mid-thigh perforator. Next, arekta perforator আছে just below the knee joint. এটার নাম হচ্ছে বয়েডস পারফোরেটর or knee perforator. আর তিনটে পারফোরেটর রয়েছে। There are three important perforators, named perforator, near the lower part of the leg, connecting the great saphenous vein with the posterior tibial vein. কি কি? একটা পারফোরেটর রয়েছে just at the junction of the lower 2/3 and upper 1/3 of the leg. একটা জাংশন রয়েছে at the level of the medial malleolus. আরেকটা রয়েছে in between the two. So there are 3 perforators, 5 perforators. একটা হচ্ছে adductor canale, mid thigh perforator বা adductor perforator. একটা হচ্ছে Boyd's perforator at the level of the knee joint. Next হচ্ছে at the lower part এ 3টে পরপর perforator. এই 3টে perforator ডাইরেক্টলি জয়েন করে না। এটা আমি ছবির জন্য করলাম। এই 3টে যে পারফোরেটর রয়েছে আলটিমেটলি যে জয়েন টুগেদার টু ফর্ম এ ভেইন known as the posterior arch vein which ultimately joins to the great saphenous vein. দরকার নেই, অত ঝামেলায় যেও না। ট্রিবিউটারি আলাদা, আর এখানে বলবে there are perforators or communicating veins connecting the great saphenous vein with the deep veins. কি কি? 1 নম্বর এটা, 2 নম্বর এটা, 3 নম্বর এটা, 4 নম্বর এটা, 5 নম্বর এটা। কেন ইম্পর্টেন্ট? সেই ভেরিকোসিটি। যদি if there is an incompetency of the valve of this perforator, one or more perforators, there is a development of varicosity. তাহলে এত কিছু জানলাম কেন? তো এত লেভেল জেনে আমার কি হবে? আছে ট্রিটমেন্টে ডিফার হবে। সাপোজ এইখানে যদি এইখানে একটা ভাল্ব আছে, পরে আসবো, পরের দিন বলবো। এই ভাল্বটা যদি ইনকম্পিটেন্ট হয়, এই যে গ্রেট স্যাফেনাস ভেন ড্রেন করছে ফিমোরাল ভেনে, এখানে একটা ভেরি ইম্পর্টেন্ট ভাল্ব আছে, নাম হচ্ছে স্যাফেনোফিমোরাল ভেন, ভেরি ভেরি ইম্পর্টেন্ট ভাল্ব। সেই ভাল্বটা যদি কি ডিফেক্টিভ হয়, ইনকম্পিটেন্সি হয়, তাহলে কি হবে? হোল গ্রেট স্যাফেনাস ভেন উইল বি ভেরিকোজ। সমস্ত একদম ফ্রম টপ টু বটম the great saphenous vein will be elongated, dilated, tortuous. Right? যদি একদম যেখানে টার্মিনেশন হচ্ছে গ্রেট স্যাফেনাস ভেন, এইখানের ভাল্বটা যদি ডিফেক্টিভ হয়, তাহলে হোল পুরোটা তুমি দেখতে পারবে, তার ট্রিটমেন্ট একরকম, অনেকটা বড় প্রসিডিওর করতে হবে। আর যদি এইখানটায় যদি যায়, ভাল্বটা যায়, এর ভাল্বটা গেল, তাহলে এইটুকুনি ভেরিকোসিটি হবে। প্ল্যান অফ অপারেশন ইজ ডিফারেন্ট। সুতরাং আমাকে শুধু শুধু ভেরিকোসিটি ডায়াগনোসিস করলে হবে না, সে তো রাস্তার ছেলেরাও পারবে। অ্যাজ এ ডক্টর উই নো, we have to know the which perforators are defective, which valves are defective. সেইটা বেড সাইডে আমরা টেস্ট করে বার করতে পারি, টেন্ডেলেনবার্গ টেস্ট বা পার্থেস টেস্ট করে। তবে রিসেন্টলি এখন ডপলার স্টাডি হয়ে এত কিছু দরকার না, আমরা ডপলার স্টাডি লিখে দিই, ওখানেই বেরিয়ে আসে, অ্যাডভান্সমেন্ট অফ দ্য সায়েন্স। কিন্তু স্টিল আমাদের এটা জানতে হয় যে কোন পারফোরেটরটা ডিফেক্টিভ, কারণ তার প্ল্যান অফ ট্রিটমেন্ট সম্পূর্ণ আলাদা। এখন এটা কারণ সবখানে তো ফ্যাসিলিটিস নেই, ডপলার করলে গরিব লোক আছে। ভেরিকোসিটি ক্যান বি ট্রিটেড ইন জেনারেল হসপিটাল, সাবডিভিশনাল হসপিটাল অলসো। গরিব আছে, তাদের আমরা যদি এরকম করে প্ল্যান করে করতে পারি, ইটস হেল্পফুল। সুতরাং এইটা গেল। এরপরে নেক্সট দিন পড়াবো শর্ট স্যাফেনাস ভেন। শর্ট স্যাফেনাস ভেনেও একটা পারফোরেটর রয়েছে, সেটা নেক্সট দিন পড়াবো। তাহলে আইডিয়া হয়েছে কি ভেরিকোসিটি এবং আরেকটা কথা বলে দিচ্ছি, না হবে না, মাথায় ঢুকবে না। তাহলে গ্রেট স্যাফেনাস ভেন ইজ ভেরি ইম্পর্টেন্ট ফর লং কোশ্চেন and with varicosity of the inferior veins of the inferior extremity. It is very important for long questions. অনেকবার এসেছে।